Before we introduce our guest, thank you very much, everybody, for coming. I am representing CMSC, which is the Chicago Medical Student Council, and we have had the distinct honor of co-sponsoring this event. We've been looking for a long time for something to sort of expand the things that we talk about in our school, the way we view medicine, because we found that the first 2 years of medical school are very linear, very simple, and not as complex as what it really is in rotations. And so an opportunity like this, whenever it comes, as soon as I read what the premise was, I was like, no, we're in. I don't care how much it costs, like, we're in. And we did it. And so thank you very, very much for planning this, and it's just an honor to be here.
Hi, everyone. My name is Jeff Mutak. I'm an M3. I'm also the current president of HPSC, which is the Health Professions Student Council. So many of you may not even know what that is, but basically we are the student council that looks over the needs of all the health professional schools, so dental, pharmacy, nursing, applied health sciences, so kind of all those programs, and we disperse funding to your student councils. We also provide travel grants. Quick plug, February 1st is a deadline if anyone has any conferences that they are planning on going to. So it's free money, apply before February 1st. But basically our role is to try and get the different schools to work together. So I know, especially in medicine, you kind of get into your own little bubble. You're starting out, you only know medicine. You only stick with medicine people. So we're just trying to kind of branch out a little bit. We really want to support events like this that are interdisciplinary, because when you get out into the working world, you're going to be with all people from different health professions. Another plug, February, at the end of February, we'll be sending an email, but there's going to have a nursing simulation. So we're going to put you into groups, students from all different health professional schools. You'll go through different medical scenarios together and kind of just meet other people. So if your student group has an event that they want to put on that you think would be beneficial for not just medicine, not just pharmacy, not just dentistry, if you think it could be if it could cross different fields, please apply, because we have lots of funding to kind of promote these events. And then just a quick show of hands, who is not from the College of Medicine here? Awesome. Yeah. That's a great turnout. So just a quick plug, remember HPSC, travel grants, we have lots of money we want to promote. So.
Hi everyone, so I'm Iwei. I'm the president of the College of Medicine Artist Group. Thank you all so much for coming, and I can't thank David from Chicago Medical Students Council and Jeff from the Health Professions Student Council enough for sponsoring our event tonight. So I am so pleased to have the chance to introduce our speaker, MK Serwick. So Ms. Serwick is a nurse and also a comics artist. She's the artist in residence at Northwestern Feinberg School of Medicine and also a guest cartoonist at Mayo Clinic Center for Innovation. So with Dr. Ian Williams, she co-curates graphicmedicine.org and is a co-author for Graphic Medicine Manifesto, which there's 2 copies up front if you're interested in looking. And then she also produces weekly Graphic Medicine podcast. So currently she's already is wrapping up her first graphic memoir titled Taking Turns, Stories from Unit 371. And she works on comics and medicine projects with colleagues from University of Chicago and also Columbia University from New York. So I am so pleased to have her here with us here today to talk about the intersection of comics and also medicine. So please join me in welcoming MK Serwick.
Thank you so much. So does everyone have at least 2 pieces of paper and a box of crayons? Great. I know a few people came in late. There were a couple of people who came in, but you will need crayons and you will need some paper. So you heard a little bit of an introduction to me, but basically I'm a nurse who uses comics to help me contemplate the complexities of illness and caregiving. And I'm a co-author on the Graphic Medicine Manifesto, as was mentioned, and I'm just finishing up, it's now going into the editing phase, my first graphic memoir, which is the story of a hospital unit in Chicago that treated people with HIV and AIDS that was open from 1985 till 2000, and it closed, and there was no recorded history of it. So I did an oral history, and I'm adapting that oral history and including also my personal memoir, and that's what that book will be. Hopefully be out from Penn State University Press in about a year, I hope. So that's that. But I want to focus in on this. I want to focus in on this, and this is what I think of as my avatar. I've spent a lot of time in the last 15 months drawing this avatar. It's changed as time goes on. That's a more current version from the book. But basically, there's a few signifiers that sort of I identify with. And so I actually think it's really empowering to have your own comic avatar. So that's where I thought we could start. I would like to have each of you create your comic avatar. If you're doing a memoir comic, you have to make decisions about representing yourself. And don't forget, this is comics. This is drawing. You can do anything. You can represent yourself in any way. So be creative. We'll take about 5 minutes to create your comic avatar. All right, we're about halfway through the time, so you should be about halfway done with your avatar. 1 minute left. Thirty seconds. Okay, that's 5 minutes. All right. So how'd that go? Fun? Pretty exciting to use crayons again, isn't it? Right? Crayons are the gateway drug. We'll get you back into drawing. Hopefully you never stopped, but most of us did. So is anyone willing to share their avatar? And just, I should forewarn you, sharing it means you come and put it on the projection camera so we can all look at it. Anyone willing to share their avatar? All right. And we have a couple volunteers. All right. Right there. There's your... Nice. So is this your drawing?
This one's Dr. Jake. Which one did you choose?
I would like you to speak to the one that you drew, because then Dr. Jake can speak to the one he drew. Okay, tell us about this.
About this?
So I noticed that you're wearing sunglasses.
Yeah.
So why are you wearing sunglasses? You like them?
Because it's sunny.
Because it's sunny. There you go. And we can see it's sunny. You got the glistening reflection on your. That's fantastic.
Yeah.
So you drew your hands kind of pointing like this. Yeah. Yeah. Nice. So it was just kind of a total look you were going for.
Yeah.
Nice.
That's the look I'm going for.
Nice. Nice. Very nice. Thank you for sharing that. I appreciate that. Someone over there was willing to share.
Actually, Dr. Jake needs to come up and talk about his too.
You said that I have this ethic, and I learned it from the disability rights movement. Nothing about us without us. Everyone gets to speak for themselves and tell their own story, right? So, you said you wanted to come up?
Sure.
Yeah? Over there. Other way? Nice. Nice. Okay, go ahead.
So, I drew my outline yellow.
Why?
My race is important to me, I guess. I don't know why I wrote I love New York. I think it actually didn't come from like a conscious place, but I think I wrote I love first, and I just had to fill it in and I wrote New York. But I think it does actually represent like how I feel about things. I try to be really optimistic about things, and I try to get into things. I love things.
Yeah.
I love to, so New York is just a surrogate for, I think, maybe what's deeper.
And wearing it kind of on your shirt, right?
Exactly, and
Yeah.
I wear it on my sleeve.
Wear it out on your sleeve. Yeah.
Yeah, no,
Nice.
it's actually pretty, like, this is therapeutic for me. How
Nice.
much do you charge an hour?
We can talk later.
Yeah.
No, it is. It's really interesting. And so part of it too is you draw a T-shirt, and then there's almost this like we got this on the shirt, right?
Yeah.
Was that? And I also like what you said. It's interesting how things came unconsciously. I'm very interested in the things that we can explore while we're drawing that we wouldn't necessarily get to if we were just writing words. Like if you wrote a verbal description as an introduction to yourself or something, it would be very different and maybe not get to that realization you had of like, I like to kind of wear forward and be enthusiastic and positive. Yeah.
I'm absolutely not this big. So I think that's part of
But avatars, yeah, avatars,
You
do
know?
whatever you want to be. That's fantastic. Thank you for sharing that. I appreciate that. Anyone else? All right. Yes. Great. And I wish we could stand here and look at all of your avatars. Trust me, I really do. And maybe later you can come and put them all up for each other. But I've got to stick to a time schedule. But thank you for volunteering. I appreciate that.
So right here?
Yeah, right on that thing, and then just you look here and see that. Scoot it down a little bit. Great. Go ahead. Tell us about that.
Okay, so that's me. I love purple, so, and I think it's reflective, like I have purple glasses. I usually am wearing some shade of purple. And then I usually have my hair up in a bun, even though it's like in a big bun in the back, and it's natural, so I think that's me. And then I got some pants on and pants.
Nice.
Of course, I love my brown skin, so
Nice.
that's it.
Nice. That's why you got to have a big box of crayons. So we have all the big
Yeah, my big earrings.
And the big earrings, right. That was the other thing I was going to point out, yeah. And I love the purple lips. That's awesome. That's great. That's great. Thank you very much. So, yeah, thank you everyone very much for sharing. We appreciate that. The other reason that we are doing that is to show you something really important. The next thing I want to talk about is drawing. But first, I want to show you some interesting avatars. So this is a cartoonist called Linda Berry. Have any of you ever heard of Linda Berry? She's actually used to have an underground comic called Ernie Pook's Comique, but she actually now teaches at the University of Wisconsin in their Science Discovery Center, doing interdisciplinary work with drawing and crayons and kids and people who are doing their PhD dissertations in hardcore sciences and trying to help them communicate better through drawing. And so I'm very inspired by her work, as you can imagine, with what I do. So it's interesting to me that this is an avatar she uses in her books to describe herself, but also so is this, right? Animals make fantastic avatars. And she has this whole persona created for what she calls the nearsighted monkey, which is how she describes herself. And then this is another book I actually have up here. It's about a neonatal ICU. Believe it or not, there's a graphic novel about a baby in a neonatal ICU. And this artist, Jenny Jekyll, she uses amazing animal-like avatars in this book. This is a book I also have here. It's a graphic novel about hospice care. A young man goes to his family home to care for his father as he's dying, and he uses this tremendous Minotaur avatar, and his father is a rhinoceros. And then, of course, interestingly, this is Art Spiegelman, who, has anyone heard of Mouse? Right? Yeah, so some of you have heard of Mouse. Art Spiegelman, actually, this is him drawing himself kind of wearing this mouse mask. He ended up feeling like he was sort of trapped by his avatar after the huge success of that book. So it's very interesting. Avatars are very powerful, so I encourage all of you to take yours home, put it on the fridge. It's sort of a power symbol for yourself. And if you didn't finish it, be sure to. If you want to keep working on it, feel free to work on it during this lecture. I definitely am of the mind frame that that drawing or coloring while you're doing something does not mean you're not listening, so you won't offend me. Linda Berry, I just mentioned her. She said once, if a 4-year-old won't draw, we worry. But if a 40-year-old won't draw, we think that's normal. Why is this? Right? I mean, the bottom line is, why don't we all draw at the service of our ideas? Because we started doing that when we were kids, right? When I walk into a first grade classroom, and I do this on a fairly regular basis, and I say to the kids, who here is an artist? What do you see, right? You see this. Everybody's like, yeah, totally, I'm an artist, it's awesome, we love it, right? If I go down the hallway and I go into like a 6th grade classroom and I ask the same question, this is what I see. You've got like one kid who's like, I'm an artist, and someone leans over and goes, no, you're not. One kid's like, God, I wish I could draw. And then other kids will just point to, oh, Billy, he can draw. He can draw, right? But we all can draw. One of the reasons we do that exercise is to show you that you have your own visual style already. It may have been left back in 4th grade when you stopped drawing, which interestingly, Jonah Lehrer in the book Imagine talks about the part of your brain that comes online around then, which actually is involved in judging yourself and judging others, which I think is a big part of why we stop drawing. The other piece of it is, right around that time, we get words. We suddenly can use words. And our teachers tell us, stop drawing pictures, put away the crayons, and just use your words. But if you think about it, not every kid in your 5th grade class was Shakespeare, right? But we all had to keep writing. Well, not every kid in your 1st grade class did photorealistic art. I mean, and the thing is, the teachers sometimes join in on this, right? Yeah, Billy, he's our class artist, right? And it's craziness. It's craziness. We leave behind a lot when we leave behind drawing. And hopefully some of you didn't leave your drawing behind and you kept going. But if you did, and you see what you draw and you say, I can't draw. Well, of course, we've all proven that you can. And imagine what your handwriting would look like if you hadn't written letters since the 4th grade. It would be right back where you left it in the 4th grade. So my mission for you today is pick it back up and keep moving forward, and keep using it. I think the bottom line is that we all can draw to some degree, we just stop practicing. Sarah Levitt, who made this amazing book called Tangles, which is down there, it's a story of early onset Alzheimer's in her mother. She said, when people say they can't draw, what they mean is they can't reproduce something realistically. I would say good drawing is one that conveys what you're trying to communicate and people can understand it. And we saw that in the examples we just saw, right? We saw that you were clearly communicating something, and I think we all, as you described what you're doing, understood what you were trying to communicate in your drawing. Here's how I see it. This is drawing, which I think is an amazing treasure chest. And this is the I can't draw gorilla, right? Because that's what I hear. Oh, I can't draw, I can't draw. I mean, look at him. He's super friendly. I think if you just distract him with a banana thrown in the corner, you can get into that treasure chest. And I think if we stop and manage to do what they do in improv, which is try to shut down, I mean, they've had people who do improv jazz in functional MRIs. And what people do when they're improving is it shuts down that part of their brain that came online in 4th grade that's judging. And if we just can suspend that judgment and just improv in our drawings and keep moving forward, we actually can really start unpacking all the things I think drawing has to offer us. So here's what I want to have, the crayon revolution. And started here today with all these crayons. I think that crayons are the gateway drug because if you think about it, if I told you to draw with a pen, you might have been a little more intimidated. But with crayons, like, it levels the playing field, right? We all feel like crayons are fun. We have these positive associations with the smell and the feel. And you know, crayons are life source. So hopefully you'll keep using your crayons. So I want to tell you 2 versions of my origin story. In comics, we love origin stories, right? So I want to tell you 2 versions of my origin story. First is the funny one, and then is the very serious one. This is the funny one. When I was a kid, Amelia Bedelia was my favorite book. Does anyone remember that book? Right? Yeah, okay. So she's a maid, and she does literally everything her boss says, and she gets in trouble, but everyone loves her anyway. I must have identified with that part, always in trouble, but people still like me. So, for example, Amelia is told to dress the chicken, and she does. I copied Amelia when my mom said, draw the drapes. My mom never thought it was very funny, though. When a patient is admitted to the hospital, the orders always call for the nurse to draw blood. The doctors never thought this was very funny either. In nursing school, pathogens made sense to me as characters. And I always explain things to my patients this way. The tests show a bug in your blood, the medicines can kill it. And it usually works. I'm telling you, Harold, she said bugs in my blood. She said bigger than atoms but smaller than mosquitoes. I want to transfer out of here tonight. I guess what I'm saying is I was kind of destined for this comics and medicine thing. I'm comic nurse. So I am a nurse. I make comics. I want to start with the serious origin story. I used to draw goofy characters like that all my life, but I never actually made a comic with the structure and the narrative flow and all that stuff until one day. It was around 2000, the end of the life of the AIDS unit that I mentioned to you. And while I was working as an AIDS nurse, I would write in journals and keep all kinds of notes to try to keep myself present and deal with all that we were seeing during the AIDS crisis. And I found myself painting these big screens with images and just very simple basic images in acrylic paint to memorialize people who I really cared about so I could find a way to externalize that experience and that grief and that memory of people. But there was a point around 2000 where I found out that our unit was also going to close, and that was a moment of celebration. This is so exciting. This is a moment in the AIDS pandemic when we can close an inpatient unit because we don't have patients, because the new drugs are working. That's fantastic. But I was really embarrassed because I was actually like heartbroken. This was a place that had been a home to me. This is a place where I really found a sense of purpose. And I wanted to be happy, but actually a part of me felt like this was just another huge loss to grieve. And so I was working the evening shift, 3 to 11, and the night before, one of my patients who I'd known for the whole, I think, 6 years I'd worked there, passed away. The meds weren't really helping. He was already too sick, and he passed away during my shift. And I was just really sad. So it was all this compounded grief. But I had to go to work at 3 o'clock. And you know, it's a funny thing in medical school and nursing school. They don't really teach us how to deal with that, right? They don't really teach us how, like, when you're heartbroken, you can still, like, meet someone new and be present to them. And so my original degree was in the arts, and I'm like, come on, there's got to be some way. And writing wasn't working. Drawing wasn't working. there's got to be some way. And this sounds crazy, but I swear to you, this is the first comic I ever made. I sat down with a blank piece of paper and I just drew this goofy picture of myself. And I really didn't know what else to do. I just wrote how I was feeling. And then, I don't know, because it was image and text, I just put a box around it. And then I thought, oh, well, that's the upper part of the page, and I guess I just put another box. And I guess now this is a comic. I did not start thinking I was making a comic. And I remembered thinking about Linda Barry's comics, which were actually, you're not familiar with her, but her work is actually about some very serious topics, like growing up in an abusive household and difficult things. And I thought, wow, I read those when I was in college, and they were really important to me, and they were serious, so maybe I can make a serious comic. And comics are so, sort of lowbrow, low bar for entry. I can just try this. So I just kept going, and I kept writing a few words, and I drew another picture, and I kept going. What I didn't know that day is that the empty space between two panels in a comic is called the gutter. And what happens in the gutter, there's actually PhD dissertations, you would not believe it, in comic studies on what happens in the gutter of a comic. It's amazing. People study this culture stuff way too hard. But what it does is it actually implies time, right? So this happened, then time, this happened, and the creator is actually in charge of how much time that represents and can use it in creative and interesting ways. I didn't know that then. What I thought of as the space between the panels sort of asked this question, like, and then what? And then what happens? And then what? And so that's what I just kept doing. I kept going. And I kept going. And rather than run you through the 9 panels this comic turned into, I want to take this back into the abstract and show you what happened for me that day when I made my first comic. I started here, and I worked my way with a little bit of drawing and a little bit of text, and I found myself here, which is exactly why I'd tried this and what I hoped would work. And I was able to go to work that day, and I felt like, again, I had externalized something in a format that worked for me. So I kept doing it. I kept making comics. I don't expect you to read these, but these are some of my earlier comics that sort of try to bridge the experiences I had as an AIDS nurse and the outside world, where I was trying to integrate these two very different worlds that I was working in. But then, so the unit closed, and I had gone into hospice care outside of the hospital, but I kept being haunted by these comics and these ways in which I was processing the world, and I really wanted them to be better. I wanted them to be informed by the role of story in medicine. So the illness narrative, what do we think of as the illness narrative? There's all kinds of interesting research in different disciplines about why we want to tell a story when we're sick, why our patients want to tell us a whole story when we just ask them, what are your current complaints? There's research about that in the fields of medical anthropology, literature in medicine. There's a whole field called narrative medicine, if you're not familiar with it. So there's a lot of smartness about there, and I wanted to put that stuff into my work. So I decided to get a master's degree in medical humanities and bioethics at Northwestern. And so there I was on the Chicago campus, not far from here, studying, and I went across the street to the Museum of Contemporary Art because they have a great graphic novel section there in their bookstore. And I stumbled across this book. It's called Mom's Cancer by Brian Feast. And I remember seeing that cover across the room thinking, wait, don't get your hopes up. It looks like a person who's experiencing chemotherapy on the cover of a graphic novel, an image I was very familiar with professionally, but certainly had never seen in the popular culture. And I got really excited. But it turned out that it really was everything I wanted it to be. It was an amazing book that critiques healthcare, that really presents the perspective of the patient in a way that we would never see as providers, because we see them across time in their home, just things we don't see about the lived experience of illness. And I really was excited about this. Brian said of making this book, he said, comics were the right medium for the story I wanted to tell. They meld words and pictures to convey an idea with more economy and grace than either could alone. And I was blown away. I went home, I read it, and I said, this Feast guy is a genius. Look at the insightful critique he's making about the healthcare team. Look how he breaks down what it's like to be a patient. Genius. Are there more like this out there? And so again, I was wrapping up my studies in medical humanities, and I wanted to turn all my attention to this, because I kind of kept it secret that I was making comics. I'm like, no, I'm a serious academic. But this is where I just wanted to forefront it and say, could this be a thing? So of course I did what we all do. I went on Amazon.com, and I found books like Cancer Made Me a Shallower Person, Cancer Vixen, Black Hole, Epileptic, Blue Pills, Lisa's Story, and on and on and on. Oh, the last line of that last panel was, has anyone organized all this? Has anyone cataloged these? And I said, came across this website called graphicmedicine.org, and a doctor in Wales had started cataloging them. I said, I'm going to email him and say how awesome his site is. And so this term, graphic medicine, was coined by Ian Williams. He set up the website much earlier, but he coined the term graphic medicine in a journal article to say the interface between comics and the discourse of medicine. What's interesting is just these crazy parallels. Ian was actually, he's a physician who makes comics he lives now in Brighton, which is in the south of England. And he was also getting a master's degree in medical humanities. And I swear to you, also literally came across that book in the Tate Modern Library, in the Tate Modern bookstore in London, and had the same experience, like, this is revelatory and we should focus on this. And so I want to make the point that most of the books, with I think one exception that I'm going to talk about, are non-fiction graphic memoirs, so they're true stories. And these books are made by the people who are living with illness and caregiving. So it's not someone on the outside doing these books. It's the person from the inside experience sharing that in comic form at varying levels of technical skill. So then I actually, I'm going to talk in a second about our conferences, but actually I now co-run this website with him, graphicmedicine.org. And I want to point out one thing. This is a version of our homepage. That arrow up there to the search bar is that one of the ways when we redesigned this site, we really wanted to make it focus on being searchable. So if you have a particular clinical interest area, or you know someone who's interested in knowing if there are comics about maybe a disease they have or for a patient or whatever, you can actually search the site globally for what you might be interested in. So then, as I mentioned, Ian hosted the first international conference on comics and medicine, basically just throwing this in the wall and seeing if it sticks. Is this a thing? Is comics and medicine a thing? And so I actually took the trip over to that conference and presented at it, and ended up then hosting the second one here in Chicago at Northwestern. It turns out it's a total thing. There are people all over the world who everyone thought they were the only one. We have an amazing international community of people throughout the world who are working in this area. And we've had subsequently 6 conferences between the US and the UK. We try to alternate. But we have opportunities hopefully coming up in India, in Australia, all over the world. We're really excited. We have some opportunities in South Africa. So we're really excited about kind of moving all over the world. And the great thing would be, after 7 years of doing this, to try to break out of just using the English language. Because, of course, there's bande dessinée and a huge history of other comics in other languages. So it's a thing. And there's 2 methods I want to focus in here today about how we're using comics in healthcare, what graphic medicine means. First, of course, there's reading these books, developing curricula for using them in medical schools and in communities and with patients. And then the second aspect is actually making comics, the actual drawing and doing this yourself. So I want to start from a platform of about 4 assertions about what the comics in healthcare do and what reading these comics in healthcare can do. First of all, I think as healthcare providers, comics, these books that are made by people living with these illnesses, can help us better understand what our patients' experience is like. That whole what it's like, you know. Someone who wanted to make one of these books said, you know, I just want people to know what it's like. You know, that's what we're really trying to communicate to our doctors and for our doctors to understand and for our friends and family to understand what it's like to have this experience you're living with. So as an example of that, I want to show you this book, which is out there. It's called Marbles, Mania, Depression, Michelangelo, and Me. It's by a Seattle cartoonist named Ellen Forney. And she visually depicts here an episode of mania. And you can contrast that to this is her visual depiction of an episode of depressiveness or depression. And then again, what I'm trying to point out here is the way in which the medium can communicate information. Imagine how many words it would require to show you the cycling between mania and depression and sort of what that sort of brass ring of balance looks like. And this is, again, by someone who's lived it. My next assertion is that comics allow us to see the lived experience of illness and caregiving it. And witnessing this, we can better understand our patients and their caregivers. And I'm focusing on the caregivers here when I show you this example from Tangled, this book about Alzheimer's. This is Sarah, the woman who draws the book, and she wrote, "Mom, can I come in?" And her mom, who has early onset Alzheimer's, the family hadn't realized how far gone it already was at this point. She says, "Of course." "Hi, Mom." "Hello, sweetie." "Having a nice bath?" "Oh, yes." Mom's clothes were piled on the floor. There was dried shit in her underwear. The bath water was full of small disintegrating bits of it. She was dipping her washcloth in the water and rubbing it on her skin. She had no sense of smell, true, but she could see. She just couldn't recognize. She couldn't recognize shit, dirt, shame, disintegration. There are moments when you have a choice. Fall apart or take a deep breath and just do what needs to be done. Drain the tub, spray the water hard so everything goes down, rinse, wash, rinse, take her hand, let her dry herself, help her with her nightie, tuck her into a warm, dry bed, turn out the light, and stand in the hallway outside her door. Feel a new loneliness and a new strength. I love that passage because that's not a story we probably will hear in the clinic. What we might hear is, we think her Alzheimer's is getting worse. Again, you know, to me this speaks to the experience of caregiving and being a daughter and so much more. And I think this is something that uniquely we get in this medium. And I'm actually excited to say Tangles is just about to be released as a animated film. They took her book and have turned it into an animated film, which I'm excited about. Next, the medium of comics has unique tools and conventions that can contribute to understanding of complex care situations. And here's an example from a book called Cancer Vixen, which is also up here. So this is the moment of diagnosis, or I'm sorry, this is the evening of the day of diagnosis. And it's pretty amazing how she's using the medium to convey that the idea of having cancer, despite the fact that they're just trying to have a nice dinner, of course is now growing in her life, much like the cells in her body, right? And is constantly present in their lives. And I think, you know, again, the medium just does a beautiful job of being able to show this to us. And there's a million examples from that book I could show you. But I wanted to tell you about another book called My Degeneration, A Journey Through Parkinson's. Recently came out. It's an amazing book about living with Parkinson's and also dives pretty deep into, I was just saying, some of the clinical work around helping Parkinson's patients and encouraging people with Parkinson's to help themselves. And this is that moment, the moment of diagnosis, from the perspective of someone who's been through it. Again, powerful book, could show you a million examples there. Along the lines, again, of what the medium can do, this is a book called Signature Wound. This is the only book here that's fiction, but it's extremely well researched. Gary Trudeau, who you probably might know from the Doonesbury comics, he spent a lot of time at Walter Reed and actually worked with real people who volunteered to sort of be models for characters. And this is about traumatic brain injury. And the medium allows us this interesting convention, is that, so we see, this is the commanding officer coming to visit the soldier who's come back from having a traumatic incident and his Humvee exploded. And we can see from his thought bubbles that his thoughts are intact, right? He's cognitively intact. But yet, when he goes to speak, the medium can show us that he has aphasia, but we can see that he's cognitively intact. And it's very interesting. There's a lot of really interesting things can be done, particularly in the medical encounter with contrasting speech bubbles and thought bubbles. So, last up is that seeing ourselves reflected in these comics, ourselves as caregivers, we show up as characters in these books, right? Because we're in these people's lives, and that's really always fascinating to me, the ways in which we're portrayed. Spoiler alert, not always super flattering, but sometimes it is flattering, and everything in between. It's very interesting. Seeing ourselves reflected in these comics, we can allow us to critique our own practice and improve our care in a really safe way, right? We're not being called out, we're not being named, but you can sit there and read this and think, oh, I've done that. I shouldn't do that, right? So I want to show you an example from Mom's Cancer. This is a section of the book that Brian calls the usual unusual. At every visit, the docs always say, call immediately if you notice anything unusual. This simple order turns out to be surprisingly hard to follow. And this is the mom, the patient. I have a headache. Yeah, don't worry about it. Oh, okay. I had a deep cough. What? You should have called at once. Oh. I feel weird stingers in my head. That's normal with a brain tumor. Oh, okay. I had a leg cramp. That could be a deadly blood clot. Why didn't you call? Sorry. I can't breathe. So you have lung cancer. What did you expect? Right. So she's wrong when she complains, and she's wrong when she doesn't. Either way, she feels stupid. How am I supposed to know? After a while, she stops trying. Again, this is about critiquing our practice, and I don't think anyone ever said any of those things to her with ill intention, but what we get in this book is the sum total of all of those experiences from the perspective of the patient. So comics have a long, proud history of showing us elsewhere what has been marginalized. This is kind of my last big point about comics and why reading them is so helpful. If you think about the underground history of comics, right? Sex and drugs and rock and roll and all of that. And this tradition has been carried on, I think, in medical comics as well. And I'm going to show you just a few quick examples. So here's a book about caregiving. you know, the details of the caregiving in the home are something that actually is pretty marginalized, not something we see in popular culture at all. Like a bedside commode doesn't show up in very many movies, right? Or example, male caregivers. This is the book I mentioned. Nye did a beautiful job about being his dad's caregiver and doing some really messy work that is the work of caregiving, and we see him go through this. Another thing that's often marginalized, the experience of living with disability. And this is an example of a zine, a collection of zines by a woman who lost both of her legs in an accident. And she just kind of talks about the day-to-day life of living as an amputee. You might have heard this book. It was actually on a lot of best-of lists last year. It was the New Yorker cartoonist Raj Chast did a memoir about her parents. And Can't We Talk About Something More Pleasant is every time she would try to raise end-of-life issues, kind of about trying to talk with your parents about end-of-life issues. And so in it, she really talks about kind of the difficulties of having elderly parents that I sigh because I'm living with this, that are stubborn. And the truth is we know we'll be stubborn someday, but we don't want to think about that. And the marginalized experience of death itself. So she actually sketched her mom while she was dying. You know, images of death, very marginalized. And grieving. This is a book a colleague of mine is working on about grief and trying to figure out ways to picture grief. And grief itself is marginalized. So as I mentioned before, well, first of all, I must say that in graphic pathographies, which is a fancy term for these kinds of books, artists are creating their own iconography of illness, which is very exciting. And in doing so, they're creating new knowledge, combining subjective feelings and perceptions with the objective visual representation. And what's really exciting about this is if you think about it, this is the first time in history, in a way, that popular cultural items that create visual iconography of illness are being created by the people who are experiencing it. Because prior to this, it was medical illustrators and doctors, and those are important, and those are great. But this is just a whole other take on these kinds of things. And as I mentioned before, I think those positioned, I learned a lot from the disability rights movement, that those best positioned to live with, represent illness and caregiving, are those living with it. And that's Latin for nothing about us without us, which is the motto of the disability rights movement. This is Dana Walrath. She made a book called Alzheimer's about her mom's Alzheimer's. And she said, around the world, comic artists, caretakers, parents, and assorted onlookers are taking up their drawing tools, pens, paper, scissors, and computers to depict illness in ways of being human that have been stigmatized. This is graphic medicine. To me, this is kind of why I'm so passionate about it, because I think it's true and it's exciting. What I haven't talked about is comics being used for patient education, which is what you think of when you think of comics being used in medicine, which of course that's true. This is an example for adults by some people at the Seattle Public Health Department who wanted to tell the story of the 1918 flu pandemic to help encourage people to get their flu shots. And they did that in comic form. And another example, pal of mine is creating a comic series called Iggy and the Inhalers. And I've got a copy of it up here. He's actually in the Chicagoland area and was featured on Channel 2 News did a story about him. He's a pediatric allergist and immunologist who also has asthma, and when he was a little kid, he created this character called Iggy to help him figure out in all of his inhalers which were the bronchodilators and which were the long-acting. Because it's actually, there's no uniform packaging, and so for a little kid, actually for anyone, I have asthma, I know this too, it's actually hard to be clear. They're similar, there's no color scheme at all, so he created these characters. And then as an adult, he's actually adapted this into a whole public health education thing that they're working with kids in asthma. And what's really cool is that he's created these characters, and their mechanism of action of the medication is tied into the superpowers of the characters. So Coltron, the controller, or Bronco, the bronchodilator. You can see where, and then he's got these stickers where they can put them on their inhalers. So like the kids are starting to understand a pretty sophisticated mechanism of action about their disease through this process, and it's very exciting. So again, comics, patient education, totally part of graphic medicine. Okay, so now we're going to move on to making comics. So you saw how I got started, and I kind of think that it's really useful and helpful. So I teach a seminar at Northwestern in the medical school called Drawing Medicine. And in that class, my students create reflective drawings, and we read and present these kinds of books and talk about them. And then we make comics on medical themes, kind of based on some of their memories. And so one of the exercises I do with my students, I want to have you do now. So one of the exercises I do with my students is I have this very vague prompt, and I tell them to make a single panel drawing based on this prompt. And the prompt is, draw the clinical encounter. So draw the clinical encounter. So we've all been in a clinical encounter on one or another side. as a provider or a patient or a family member. So think about, you draw it from any perspective. So it isn't just people who are providers. And we're going to do 5 minutes for this. About 1 minute left. About 30 seconds left. Okay, that's time. Feel free to keep working on those if you want. Would anybody feel comfortable sharing their drawing? Anybody done enough? Yeah, come on up. Put it on there. Thank you.
So actually, I kind of cheated a bit and saved time by reusing my original avatar.
Nice. That's great.
And that means I didn't have enough space on the paper because I didn't have enough ink to have us draw.
So tell me, so what's the?
So,
Go ahead. Tell me about it. Just tell me.
okay. So, so let's see. So I basically tried to draw like the main client's like shirt, tie, white coat, his stethoscope. So yeah, as you can see, I have a blue shirt. I have like one shirt of each color except for blue, which I have two, which means that on average I'm most likely to be wearing blue on any given day.
I love that you thought that through. That's awesome.
Yeah.
Tell me about what's right in front of you, like what's in your hand.
And that's me taking notes on a piece of paper and pencil while talking to the patient who's facing me, which conveniently saves me having to draw her face because as you can tell, I'm not that good at
That
drawing.
looks good to me. Communicating information. That's great. Great. I appreciate that. So it's kind of you doing, like, interviewing your patient. That's wonderful. Thank you. Thank you for sharing that. I appreciate that. Great. Who's next? Yeah, thanks. It's a brave thing to do. Who's next? Who's willing to share their drawing? All right, we got a hand back there.
So I can't believe this took me 5 minutes to draw, but so right now I'm an M2 and we're practicing the physical exam a lot. So this is, I guess, me taking the pedal pulse of a patient, and it's one of my favorite things to do. I recognize because I don't know. There's something symbolic about like to do that. You have to get down. You know?
Yeah.
And I think that like symbolically is a cool. I don't know, representation of like, I mean, it's like very vulnerable to do that, and I think the patient like, you know, really appreciates that, and yeah, and also the vulnerability on their end from taking off their socks and shoes too. So it's an intimate experience, and that's what I identify with the clinical encounter.
That's really wonderful. Thank you so much for sharing that. Yeah, that's great. That's so specific and wonderful. And, you know, I've spent a lot of time thinking about these kinds of things. I never thought about it that way. Because you're right. I mean, I grew up in a religious tradition that I think there's actually a line, something like the greatest among you will be found washing the feet of the others, like attending to the feet of people. And so, but I'd never thought about it in the clinical encounter. That's wonderful. Yeah, thank you so much. I love that. Yeah, you got all right. Again, we're somewhat close on time. I'd love to share so many of these.
Okay, I can start talking already. So I'm an M1, so we're doing a lot of patient interviewing right now. So I'm coming at it from more of that perspective. So I think what I've been thinking a lot about in my clinical encounters as a first-year medical student is I feel like I have a zillion thoughts in my head, and I'm thinking about what could be going on. I'm thinking about whether I'm making the patient comfortable. I'm thinking about am I forgetting to ask certain questions or this or that. And I know that as a patient and patient experiences can be at what do I disclose and can I trust this provider, and is this weird, is this normal, is this gross? So that's what came to mind.
That's really wonderful, and you really did what I was saying, that because I think it is really powerful in the clinical encounter to contrast the thought bubbles and the speech bubble. Because if you look at this, it's just two people saying just two simple things.
Yeah.
But boom, look how much is happening in that room, right? And I think it's really intriguing. So was this a function of time, and you got finished in terms of the not having a face or hands?
I drew first, and then I started writing, and so I think maybe it would be something I came back to, but I got that down, and then it became more important to get the whole idea down, I think.
Yeah. But also it takes on a certain power.
Yeah.
Right? It takes on a certain power, just exactly as it is. also, I think, was quoted as saying something like, art doesn't ever stop, art doesn't ever really finish, it just stops in interesting places, right? And that definitely stopped in a very interesting place. Thank you so much. I appreciate that. So I'm hoping that it's pretty self-evident how, I think, interesting and helpful and reflective of exercise like this might be, right? I mean, how many times have you had to think about that kind of thing? And I'm curious if any of you had insights as you drew, right? Things you never thought about, like, is there a computer in your drawing? Is that something coming between you and a patient? You know, the little stool, that always shows up. What is that about? It's on wheels, and their chairs aren't on wheels. Like, what, you know, it's always fascinating to me, like, things that people come up with as they're drawing because they never thought about making those things concrete in how they think about their encounters with their patients. And I have so many interesting stories, and I'll skip most of these, but the ones, a lot of times M1s will do lots of doors and long, scary hallways, right? Because that's, you know, the person who drew this said something like, you know, once I get there, it's fine, right? It's just the whole anxiety of getting to it. This, for example, the elephant in the room is the patient and I both know I have no idea what I'm doing, right? And when I talk about people's work, one of the ethics in my course is that everyone speaks for their own work. And so you may say that's a cat, fine, it's a cat. You said it was a cat and you drew it. I'm very much on, again, people represent themselves. And so when I quote what was said about these, it's not, it's what the person who drew it said. This was, again, I always think about this wheels thing because of this one drawing, and I'll never think about the pedal thing again because of your one drawing. It's very interesting how this stuff really just sticks. The person who drew this said something like, you know, really contrasted the body language between the provider and the patient. You know, you could feel the anxiety in the patient, and you try to see the effort on the part of the provider. But what the person who drew this focused on was the fact that their chair was on wheels. They could get out of the situation. For the patient, they're in this situation, and this is where they are residing. And one of my last favorite ones is this one. I think it shows the power of very basic visual language. The guy with the giant heart in the arm is the first-year medical student, and the patient is crying. And he said that he wanted to keep this on his wall to remind him that this is where he started, this is what he wanted to be as a doctor. And that, you know, and I followed up with him a few years after he did this, and he says, as medical school goes on, there's so much packed into your head, and there's only so much room. It's a, you know, closed container. And so sometimes this is what goes out. And, you know, he was really excited that I brought this back and reminded him of this because he wants to kind of keep that in the forefront. So I don't have time to go into comic making, but you can imagine, I told you how I made a comic. That's pretty much all it takes. Just image, image, text, image in a sequential fashion. That's a comic. The educator Jonathan Kozel said, words and pictures lead to a dazzling dance of the dialectic that propels us into asking questions we have never asked before. This is a book called Cartooning, Philosophy and Practice. It's actually a tongue-in-cheek title because the entire philosophy and practice of cartooning is in the book instead. It's by Chicago cartoonist Ivan Brunetti. It's got some great exercises, and I say that if you're interested in kind of thinking about it further in the future. But what Ivan said in this book is that the deepest realizations come to us from the daily practice of drawing. It is the pencil that teaches best. And so if I did anything here today, I hopefully encourage you to pick your pens back up, even as a study tool, your markers and your crayons and all that stuff. I think in the interest of time, I'm going to have to skip talking about this very much, but this is a geriatrician in Brighton who's using drawing and comic making to explore what has medicine done to her. This is the first page of her PhD dissertation in education and medicine. And she uses it to link practice and theory. I've got to run through this real fast. And I think this is a fun image to show sort of like, you know, what happens on the wards is at the top, but she can use comics and drawing to sort of do this archaeological dig beneath what is happening on the wards. And to tell you this is all being taken very seriously, the Annals of Internal Medicine now has a graphic medicine page thanks to the work of a whole bunch of wonderful people. And so you can go there and see some great examples online. I'm wrapping up here our conference. Now, there was someone here who talked about all this great money available to travel to conferences. Well, if they're willing to take you to Scotland, you can propose something for our Comics and Medicine conference. This coming year, we're going to be in, or this current year, we're going to be at the University of Dundee in Scotland. And if you can't make that trip and you want to work on a project maybe, the following year, 2017, we're going to be back here in the States in Seattle. And the topic we're looking at, we kind of look at broad themes of sort of the performance of roles and the performance of comics, or sort of performativity in comics and in medicine. I think this is the last thing. This is a guy named James Sturm. He's at a place where you can actually go to get a degree in comics, the Center for Cartoon Studies in White River Junction, Vermont. And he's doing really interesting work working with veterans in the VA looking at helping them to kind of talk about the experiences of conflict and perhaps trauma, and work with comic students and just sort of work through that in a therapeutic way. Interestingly, of all the possibilities you can imagine of getting people living with illness who don't find this on their own, like in an art therapy realm doing this, the only real, besides children, as adults, the only real stuff I'm hearing about is coincidentally all happening with veterans and dealing with PTSD, which is very interesting. And he said, comics are a blowtorch. So far, we've only lit a few cigarettes with them. And I think that's really true. So thank you so much for coming and playing along with my little game here tonight. I really appreciate it. I can be reached on Twitter. I'm @ComicNurse. You can follow, if you're interested in graphic medicine and you're on Facebook, go to the Graphic Medicine Facebook page and like us. It's the great community of people, as I said, from all over the world who are really interested in this stuff. And it's actually, of all the ways we try to stay connected between our conferences, Facebook really just organically happens, and it happens really nicely there. So yeah, my website is comicnurse.com if you want to see more of my work. And thank you again so much for coming. I really appreciate it.